Hi, I'm Dr. Monty Palo, and I just wanted to take a moment to describe the way patients present to my clinic with the diagnosis of carpal tunnel syndrome. So patients typically come to my clinic with complaints of either sensory or motor changes along the distribution of the median nerve. So the median nerve, as we've already learned, is a nerve that comes from the neck, goes down the arm, through the carpal tunnel, and branches to supply sensation to the thumb, index, long, and half of the ring finger. So when I say patients have sensory changes, what I'm talking about is they feel different in this distribution. Maybe it's hypersensitive, maybe it's not as sensitive, maybe it's numb, maybe it's pain, again, in these fingers. Probably the most common complaint I hear. People wake up in the middle of the night shaking their hand, trying to get sensation to come back to those fingers. The reason this works is it actually relieves some of the blood flow problems that occur with carpal tunnel. So let's talk about some of the other things that people will complain about. Sometimes they complain about weakness in the hand. They complain about dropping objects. And one of the reasons this occurs is because the nerve actually has a branch after it goes through the carpal tunnel that comes back and supplies sensation to this part of the thumb. This part of the thumb is called the thenar eminence. And what will happen usually with advanced carpal tunnel is this musculature will start to kind of waste away. And that's what we call thenar atrophy. You know, atrophy just like you have when you wear a cast on your leg, your calf atrophies. Most people are familiar with that. Well, thenar atrophy is the same idea, but it's in your hand. But this leads to weakness in the hand, and that's what makes people start to have that dropping problem or the weakness problem in the hand. So that's probably the most common way people present to my clinic with numbness and tingling in the hand. Now, the National Institute of Occupational Safety and Health defines carpal tunnel syndrome as having two or more of the following criteria. One or more of the following symptoms affecting at least part of the nerve distribution of the hand. Again, the median nerve comes from the neck, goes down the arm, through the carpal tunnel, and supplies sensation to the thumb, index, long, and half of the ring finger. So if you have either paresthesia, which means it just doesn't feel quite right, it's a little less sensitive than normal, hyperesthesia, which means it feels super sensitive, pain, or numbness, then that is criteria number one being met for carpal tunnel syndrome. So if you have one of those symptoms plus one of the signs, which means a physical exam finding that we're about to talk about, then you, by definition, have carpal tunnel syndrome. So let's talk about the signs. So if you have a positive Tinel sign, a positive Phelan test result, or diminished sensation to pinprick in the median nerve distribution, that's considered a positive sign on physical exam. Now let's go through each of those tests. Positive Tinel test means that when you tap above this crease, this is called the distal wrist flexion crease, okay? When you tap right above that crease and you feel shocking sensation going into these fingers, that's carpal tunnel syndrome. The Phelan test consists of putting your arms in a bent up position. A lot of times we'll rest it on a table, putting the backs of the hands together and fully flexing the wrist. A positive test means you get numbness or tingling in that distribution of the median nerve. Sometimes the test takes up to a minute to become positive, but if it's positive, that's considered a positive finding. So I'm starting to get numbness and tingling right now because I have carpal tunnel syndrome. So I'm going to shake them awake, and I'm good to go on. Now, pinprick, that's pretty obvious. If you compare the two sides, you take a little pin and you compare the two sides, then that's, if it's diminished on your normal hand, on your bad hand, then that's considered a positive sign. So that's really all it takes, according to the National Institute of Occupational Safety and Health. Positive symptoms and a positive sign. Thanks.